I heard a really, really strange comment from the former NIH director, Francis Collins, on a podcast.
So give me a framework. How do you think about that? How do you put that on the scales and say, yes, it's okay to use tissue of aborted fetuses?
It's a tough one, Keith. It's a real tough one. It's interesting. If you go back to the Reagan administration, this question first came up. They came to the conclusion that it was, in fact, ethical under very strict circumstances to conduct this kind of research. The approach about consenting for donation of the tissue had to happen after the termination had already occurred, not before. And so as NIH director, I didn't make up these regulations. They were already there, where fetal tissue research under those conditions was being carefully overseen. It seemed to me it was ethically justifiable.
I was just speechless when I heard that because that is absolutely not what the protocols are. The moms are still pregnant when they're given these forms that really laud the social benefits of going forward with the abortion and signing away the child's body.
I mean, it's unfortunate that either the former NIH director does not know what's actually going on in these facilities that he's funding, or worse, that he does know and he's mischaracterizing it intentionally to deflect some of the criticism from the public about what actually happens. And unfortunately, we saw that a lot with Francis Collins. I mean, there were a lot of animal testing scandals during his tenure. I've been doing this work for over 20 years. He was the NIH director for a long time. And there were many things that we now have records of FOIA, Freedom of Information Act documents through email, where privately in emails to his colleagues, he was conveying that he was concerned or opposed to certain things that the NIH was doing or thought they were useless or problematic. But publicly, he was supporting them and saying they were absolutely necessary. So at the end of the day, the NIH director is a politician. Francis Collins was a politician. And when you're a politician, in a lot of instances, unfortunately, you're not as principled as you could be. And I think we've seen that a lot with a lot of different people at NIH.